have you got sort of principles that you look at a situation to become a better paramedic and a better man and a better way of doing it? What feedback do you look for so you know that the next time you go? Because I'm assuming, like when you're doing the tactical stuff, you're seeing stuff, and it's, did you apprehend the subject? Were they controlled okay? Did you need to give any? We got them there without this, and then we had to give medication. And my modification on my battle armor, I needed this easier, but it was down by my leg, and so, that sort of thing. How do you deal with that for feedback, but also when you get a call and it's a car smash and there's three families involved? What are you doing? Do you have a similar approach for both styles of medicine?
Yeah, so we have a personal one. I have my personal system, and then we have systems in place as an organization to kind of help us do just that. For me, it's I look at any time I feel uncomfortable. So that goes as far as just checking the helicopter in the morning when I'm going through the equipment, making sure we have everything. If I lay my hand on something and I don't instantly know what its indications, contraindications, functionality is, when I'd use it, how I'd use it, that's a sign to me to go look it up, or to ask my partner to take a quick in service or go on YouTube and watch a video talking about it. There's so much information. So for me, discomfort is a sign that there's something you can't do or don't know that you should be able to. If you feel uncomfortable, that's a sign that there's something you could probably do to make yourself feel less uncomfortable in that situation. So that's what I do preemptively, is I kind of look things up and make sure that I'm familiar with what we're dealing with. As far as like looking at a call and kind of debriefing that on how to get that better, at least on a technical side from a provider level, kind of the same thing is what went right. On a SWAT call, that's looking at, what I have on me, and somebody comes up to me and asks me for XYZ and I didn't have it. So next time I'm going to make sure that that thing is accessible or that I have that. Or I'll look at the last year and be like, I've never used this tool in this pack. I think maybe it's time to take it out of there. So from a technical standpoint, that's what I do. As far as an emotional standpoint and kind of looking at like how do you move on, how do you kind of leave work at work, make sure that you're taking care of yourself from a mental health standpoint. I've been lucky enough where I haven't had any mental health struggles from this career, and I understand that that is not a universal experience. And I'm sure, now that I am a father, I haven't gone on any horrific pediatric calls since then, but I'm
Mm.
kind of holding my breath to see how that will feel when that time does come, and it will come eventually. But for other people, and I've been involved with a lot of these processes, is just talking about it on a peer-to-peer level. There's a lot of data out there to suggest that going to have nachos with your coworker and discussing things in a constructive manner and not a critical manner is almost just as effective as having a formal critical incident stress debriefing. Just having those support systems, people that understand you, like does it might not be your spouse. Your spouse might not truly understand what you're doing, what you're going through. So finding somebody that does understand and talking through that, I think, is huge. Um, but like I said, a constructive method of doing that is big. Is not being like, oh my God, you should have really put that tourniquet on in a different place, or wow, you were losing your mind. What's wrong with you? Like that's not going to help anybody. But being able to
Mm.
talk through what happened and what you could do next time is big.